So we're here today to show you how to take some good samples for COVID-19 or other respiratory viruses. So the first thing to say about these samples is that if your patient is producing sputum, sputum is a very good sample for COVID-19 or other respiratory viruses, so please send us sputum. If the patient is not producing any sputum, then we would like you to take nose and throat swabs. I'm going to take you through the process of taking nose and throat swabs. So the first thing to say when you're preparing to take some samples from the patient is that you need to get all the equipment that you need and the request forms that you need to do the samples. You need to get it all ready first before you go in and see the patient. So the request forms that we need, we have a standard microbiology request form for the South Eastern Trust, and that's what you need to send samples for straightforward influenza testing, flu testing. Now, in addition to that, there's a specific sample for COVID-19 which goes to the Regional Virology Lab in Belfast, and this is the form that you need to fill out for COVID-19 testing. Fill the forms out as completely as you can, including all the symptoms that the patient has, and all the different boxes in the form should be filled out. Okay, so if we come now and look at the equipment that we actually need to get ready to do our virology sampling. So we need to have in total 4 dry swabs, and we need 2 sample bottles that those dry swabs are going to go into. We also need a cloth which has been moistened with Actichlor, and what we're going to use this cloth for is to clean down the sample bottles before we put them into these bags, and then we put them into the transit bag which is going to the laboratories. Now the reason we've got the Actichlor and the multiple bags is that we're trying to protect everybody involved, trying to protect the laboratory staff and the portering staff and everybody, and not have them come into contact with any potentially infectious material. So once you've set everything up, you've got everything where you need it in your patient room, and you've filled out your forms, then we are going to get ourselves to wear the appropriate personal protective equipment and take some samples. For this purpose, the protective equipment is simple fluid shield mask, a visor, gloves and an apron. So now that we're ready to take our samples, when we go into the patient room, the only things that we need on our trolley or our inside our patient room are the swabs themselves and the sample bottles. So we're going to take 2 throat swabs, and we can take these swabs simultaneously. One of the swabs is for coronavirus testing, which goes to the Virology Lab in Belfast. The other swab is for straightforward influenza testing, which is done in South Eastern Trust. So as I say, we can take these 2 throat swabs simultaneously. Just ask the patient to open your mouth, please. I might use a tongue depressor to keep the tongue down, and I'm going right back to the tonsils, and I'm going to give a little bit of agitation around the tonsils to get a really nice specimen, and out we go. So now I've got 2 throat swabs, and I'm going to break one of these throat swabs into each of my sample bottles. So one goes in there, and another one goes in here, and then I'm going to do the same thing with 2 nasal swabs. So nasal swabs, again, you can use 2 swabs simultaneously to do this. You're just going to approach the patient into the nose, straight back, just a parallel to the roof of the mouth, and out it comes. And again, I'm just going to break this swab off, and it goes into the same container that the throat swab has gone into. And with another one, I break it off, put it into the container that the other throat swab has gone into. So now I've got 2 samples here, a nose and a throat swab for coronavirus, COVID-19, and then I have another sample bottle, again 2 swabs, a nose and a throat swab for straightforward influenza. So having done this, then I want to hand these samples out of the door of the room. So once the sample is outside the room, then the sample bottle gets wiped down with the Actichlor Plus soaked wipe, and that's just to decontaminate the sample bottle, and then that bottle gets put inside one of these bags, and then you can close that bag off, and you put it inside the second bag, like so. Now for with this second bag, this is the bag where you put the specimen request form that's been filled out, and then you have that. There's the one for the one that's going to the virology laboratory. So both these specimens are now appropriately bagged, ready to go, and they go into the final transit bag, just in here, and then they're safe to be sent to the laboratory.